Assalamu alaikum wa rahmatullah wa barakatuh. Ladies and gentlemen, honorable guests, respected board members, distinguished guests, and my fellow colleagues. Good day to you all. To start, I would like to introduce myself, Alia Shawab, the Scientific Committee Chairperson of the Second Clinical Nutrition Society and Conference. And on behalf of the Organizational Committee and the Emirates Clinical Nutrition Society, it is with great pleasure to welcome you all to the second edition of the Emirates Clinical Nutrition Conference. This year, it's brought to you in a unique hybrid format, and to thank you all for attending the conference, whether physically with us or attending virtually online. To start, let's commence with the national anthem. Please rise.
بسم الله الرحمن الرحيم إنا فتحنا لك فتحا مبينا ليغفر لك الله ما تقدم من ذنبك وما تأخر ويتم نعمته عليك ويهديك صراطا مستقيما وينصرك الله نصرا عزيزا هو الذي أنزل السكينة في قلوب المؤمنين ليزدادوا إيمانا مع إيمانهم ولله جنود السماوات والأرض وكان الله عليما حكيما.
First, I would like to express my gratitude and an acknowledgement for a successful collaboration with the World Health Organization East Mediterranean region, represented by Dr. Rana Haja, Deputy Regional Director. The Ministry of Health and Prevention, represented by Dr. Noor Khamis, the Director of Health Promotion and Promotion Department. The Abu Dhabi Public Health Center, represented by Dr. Maryam Al-Mansouri, Section Head of Nutrition Department. And I would also like to welcome as well all the GCC and MENA Nutrition Society leaders, presidents, and the members present with us virtually and here. I would like to extend my gratitude to our sponsors and industry partners to thank them for their support and joining us today to make this conference successful. Yakut, Middle East, Nutricia, Middle East, Al Hayat Pharmaceuticals, Leader Healthcare. At this year's conference, with the theme of Advancements of Nutrition and Health, we will be covering a wide variety of topics, which includes advanced nutrition technology, nutrition support and healthcare, metabolic disorders, obesity, sports nutrition, and many more. This conference is a CME accredited event. Accordingly, you are kindly requested to scan your code received on your email at the beginning of the registration and at the end of the session to benefit from the full CME hours. This conference is accredited with 14 CME hours from Dubai Health Authority. For the virtual attendance, your CME hours will be calculated based on your online attendance. To be part of the sustainability initiatives, we are excited to announce that the Emirates Clinical Nutrition Conference will be a plastic-free event in partnership with Dubai Can. By eliminating single-use plastic bottles, we are doing our part to reduce waste and protect our planet. This is why we are distributing cans at the exhibition area and registration, where you can refill your cans with fresh and flavored waters from the water station booth. Feel free to refill your bottles at any time. At the end of the opening ceremony and as part of our ongoing commitment to sustainability, we will be planting ghaf trees as a symbol of our gratitude and sense of community as well, as a reminder to protect life and maintain a healthy environment. The preservation and the protection of one of the UAE's priceless artifacts will always be a priority for the Emirates Clinical Nutrition Society. The ghaf trees can be planted to improve the area's nutritional values. And as you can see, as the branding of our event logo, which represents the ghaf tree stems and leaves. Each stem represents an emirate, which is a symbol of the 7 Emirates of the United Arab Emirates. Moving forward, I would like to invite Ms. Afra bin Ketta, the Vice President of the Emirates Clinical Nutrition Society and the President of the conference, for a short talk.
الرحمن الرحيم والصلاة والسلام على سيدنا محمد. السلام عليكم ورحمة الله وبركاته. Ladies and gentlemen, honorable guests, respected director and all our delegated attended this event. My name is Afra bin Ketta, representing the President of Emirates Clinical Nutrition Society and Conference, Ms. Muna Shammar. And on behalf of the society, I would like to express my appreciation and gratitude to everyone for attending the second Emirates Clinical Nutrition Conference in 2023. First, I would like to thank the following people and institutions who have been an important part of this conference. And I would like to acknowledge the following Dr. Moza Sharhan, President of Emirates Medical Association, with the Emirates Medical Association Board of Emirates Medical. The Emirates Clinical Nutrition Society Board of Directors, namely Muna Shammar, President, وعلي الشواب, Scientific Committee Chairperson, Rayyan Al-Ali, Culture Committee, and Raisa Al-Chetbi, General Secretary. And last but not least, the international, regional, and local faculty and moderator from the different parts of the world who have taken the time out from their various busy schedules and commitments to be with us in person. And in some cases virtually, despite the time difference, to give us their valuable insights on some extremely important topics. Our commitment to education and keeping ourselves updated of the latest update and hot topics is paramount, and we as Emirates Clinical Society will continue driving this into 2023. Our society, learning, research, and development continues to be an integral part of our conference. And I am also pleased to announce the Emirates Clinical Nutrition Society Conference 2023 had interesting submission of abstracts from all over the world. After extensive review process led by the board, we have taken the opportunity to invite the top 6 oral abstracts to present at the conference in the evening sessions. None of this would have been possible without the support of all our partners and sponsors who have supported the first edition of the meeting. And we would like to thank them again for the continuous support. I would like to start the thanking our partnering and institution. First, Saudi Society of Food and Nutrition, Omani Nutrition and Dietetic Society, the Nutrition Society of Malaysia, the Emirates Society of Rehabilitation and Sport Medicine, the International Society of Departmental Organs of the Health and Disease, the Emirates Oncology Society, the Emirates Pediatric and Neonatal Society. And special thank and big thank for the great effort of our speaker from the Sudan, representing the Sudanese Childhood Diabetes Association. All our prayers and thoughts are with them. Our academic collaborators, Abu Dhabi University, University of Sharjah, the United Arab Emirates University. Finally, sincerely hope you all will enjoy the 2 days conference full of debate and networking. I declare that the conference is open for further proceedings. Thank you.
Thank you, Ms. Afra, for the wonderful insights. Now, I would like to invite Dr. Rana Hadja, Deputy Regional Director for the World Health Organization East Mediterranean region, to give us a few insights.
Good morning. Sabah al-khair. Can you hear me?
Yes, we can hear you.
Okay, great. Thank you. Thank you so much for inviting me to this important meeting. And I'm sorry I cannot be with you in person due to other commitments, but it's very nice to be with you online. And thankfully now with the hybrid modality, we can attend these meetings online. I would like to, I know this is an area that you all know very well. I would like to give you just a little bit perspective from WHO in terms of the major global health issues we are dealing with now, as you all know. And I very much appreciate what was mentioned already in the opening about the environmental friendly meeting. And I would like to start by also acknowledging the really unfortunate crisis in Sudan and wishing all our sisters and brothers in Sudan hopefully a return to safety and really peace in the country and peace of mind. And of course, you know, this issue of now nutrition and access to good food is very much a vital concern for all of us and for all of Sudan. So in our region, we are known to have so many emergencies, and we are known to deal with both spectrum of disease. So that's always something that we take into perspective when we address the major public health issues. I would like to start by, of course, acknowledging, as you know, that our region, as I just mentioned, faces a double burden when it comes to nutrition. We have undernutrition and malnutrition, a big issue with also alongside the same issue of overweight and obesity. We have more than a quarter of the children who are under age 5 in the region, just to give you an idea, which is over 22 million children have had their growth stunted by chronic malnutrition. This is a major issue remaining in our region because, as you know, stunting affects education, affects even the potential of countries for development, and that's really something that concerns us. So we have more than 7 million young children in our region who are too thin because they are affected by acute malnutrition, while at the same time, we have another 7 million under 5 children in the region who are overweight. So we have to deal with both issues and give each one of them its adequate attention. Of course, our priority is always to make sure kids and the whole population has access to adequate and healthy nutrition. We also know that our region has some of the highest rates of adult obesity and overweight in the world. Also, a very high prevalence of diet-related non-communicable diseases such as diabetes and cardiovascular disease, which makes the focus on the diet really very important. Of course, as you are all quite aware, at the global level, non-communicable diseases such as cardiovascular disease, diabetes, are responsible now for around 41 million deaths. In 2016, unhealthy diets were categorized as the second risk factor contributing to the global burden of diseases, accounting for almost 11 million deaths in 2016. I mean, of course, there are many other factors, but nutrition, as we always say, is something that is relatively under our control, which makes this also very important. One of the main other risk factors common in our region as well is physical inactivity, which is also rated as one of the chief factors causing global mortality and amounting itself for over 1 million deaths, 1.3 million global deaths. In our region, the increased incidence of type 2 diabetes, obesity, cancer, cardiovascular disease, and other diet-related non-communicable diseases among adults are becoming the main public health concern in most of the Arab countries. The economic expansion, of course, as you all know, has contributed to a major nutritional shift from a traditional seasonal diet to a westernized diet and eating habits, of course, coupled with a sedentary lifestyle. And despite the rising concern for non-communicable disease mortality, the public health policies that we have in place are not yet adequately addressed. Of course, as a region, we are doing a lot to address this, but mainly by focusing also on policies that look at, for example, added sugars and sweets, salts, and all like fortifying food, etc. This, I think, having the right national policies is really very important. And I know that Emirates, for example, we just had not a long time ago, we had our meeting on nutrition in the Emirates and focusing on policies related to sweet beverages and others, and they have taken some major steps to ensure that the right policies are in place. We start with policies and then we move to implementation with many other issues. Of course, we are just coming out of the COVID pandemic. I think you all heard that yesterday. Finally, I think we were already, our Director General, Dr. Tedros, announced that COVID-19 now cannot be, is not anymore a public health emergency of international concern, which is what we call the PHEIC, P-H-E-I-C, which is really good news because for a long time, almost the last 3 years, we have been so focused on COVID that we lost a little bit the attention on many of the important issues, in particular non-communicable diseases. But now it is the time to focus again on non-communicable diseases, on prevention, not only of the primary risk factors, but also on improving overall management of non-communicable diseases, because we have to reach the Sustainable Development Goals by 2030. And in many of our countries, we are really behind on reaching the SDGs. So the diet issues really become very critical. And I think, as you all know, the intake of the energy-dense foods has negatively influenced public health care and social and economic practices. It's not just about diet. The fact that we have all this obesity in our region is affecting the whole cost of healthcare, has significant impact for societies. High body mass index, the high blood pressure, physical inactivity, the unhealthy diets are major risk factors for non-communicable diseases and contribute to the significantly increase in what we call the disability adjusted life years, which is a way we measure the morbidity that comes from non-communicable diseases. In our region, the populations again have experienced a very nutritional shift where they used to have a very diverse diet that was high in fruits and fibers and whole grains, vegetables, and then they moved to a more refined diet, more carbs, more carbohydrates, more trans fats, more saturated fats, salt, and sugar. And especially the economic expansion, especially in high-income countries, the rapid urbanization, the shift in our lifestyle, and the globalization of marketing has made many of these foods very attractive, and they have also contributed further to the nutritional transition. So we have, I know, I fully appreciate that as a clinical dietitian and nutritionists, you have huge challenges to deal with. But sometimes, you know, good things come also with their side effects. In our region in particular, in our Gulf countries, the economic development, which is especially with all the additional increase in the income in many of these countries, have led to a major lifestyle and significant chronic diseases that we have to deal with. The unhealthy, you know, we talk about undernutrition, but there's actually malnutrition can be both for undernutrition and for overnutrition. People who are eating a lot and are obese are also suffering from malnutrition. And basically the food systems in our region, in many of our countries, they are failing to deliver the affordable, healthy diets for all. In some countries, we have 90% of the population cannot actually have access to a full healthy diets. We know that countries are working hard to address these issues, and we as WHO, we try to increase the awareness in these countries about the importance of these issues, because always, as you know, chronic diseases sometimes do not get the attention they need, especially during like major emergencies in outbreaks, pandemics, but also in our region, we have so many other emergencies, and always the issues related to diets and to non-communicable disease become less priority. So one of our biggest, I think, support comes in increasing awareness and making sure we have the right data in countries, and also in working with countries to establish the right policies to deal with the issues of obesity in adults in particular, but also we need to start thinking about the children. The policy action really is needed because, as I mentioned, that's what's going to transform the food health systems and to create healthier food environments overall. The member states now are our countries, as we call them, member states. There is a regional strategy on nutrition. It's a 10-year strategy. Our regional committee, which is the committee for WHO that includes all the ministers of health, endorsed this strategy in 2019, and we basically now work with the countries to make sure that the strategy leads to adequate implementation. We are also promoting packages to implement packages of various actions on food systems so that we improve the nutritional quality of food along the side of improving the food supply chain, and also to create healthier food environments. Such measures, for example, include nutrition labeling, food and beverage reformulation, as you have seen lately, public food procurement and service, food taxes and subsidies. We have data from the region showing that, for example, increasing tax on sweet
think we lost connection. Thank you, Dr. Hajja, for your phenomenal contributions, as always.
Yes. Hello, can you hear me? I'm finishing up. I think it's very now increasingly what we are seeing, the role of the clinical dietitians really is becoming more and more important in managing obesity and non-communicable diseases, and through a well-structured lifestyle interventions that involve not only addressing the diet, but also involving behavioral therapy approaches, personalized goals for diet and physical activity, which have already been found to be quite effective to improve the health outcomes. And the critical role of nutrition overall in disease prevention, health promotion, chronic disease management, I think now is undisputed, and it's well recognized. Relatively, the nutrition intervention is considered the low-cost and effective way to promote health overall, because with the right guidance and attention to what is consumed, people can improve their nutrition and health status. And I think it's very important that we start very early, as was mentioned earlier. It's very important to change the whole mindset, the culture. We start very early, even in schools, so that kids grow up with what is known to be healthy, and to get them to practice eating, the eating habits, healthy eating habits. So maintaining the optimal nutrition status at any age is very important, can contribute to preventing major chronic diseases. It will have less episodes of illnesses, shorter also, and less expensive hospital stays, because it has actually now major implications on the overall cost of healthcare, in addition, of course, to the obvious benefit to the health of the individual. But our goal is to build healthy societies, excuse me, healthy populations. So with that, I would like to thank you again for inviting me, and wishing you a very successful meeting, and look forward to hear from the organizers about the outcomes of the meeting. Thank you and good luck. Thank you.
Thank you very much, Dr. Hajja, for your phenomenal contributions, as always. Now, I would like to invite Dr. Nouf Khamis, the Director of the Health Promotion Department, to give us a few words.
Assalamu alaikum wa rahmatullahi wa barakatuh. Your Excellencies, distinguished guests, it's an honor for me to be here today with you in this important conference, the second Emirates Clinical Nutrition Conference, and I would like to take a moment to express my appreciation to the Emirates Clinical Nutrition Society for their efforts to support and enhance the work in the nutrition field. This conference will present an opportunity to discuss the latest and most pressing developments in the area of healthy diet. By coming together and sharing knowledge and expertise, we hope to pave the way for a healthier and more prosperous future for our country. Ladies and gentlemen, the UAE are committed to achieving both Sustainable Development Goals and global and regional nutrition goals. These efforts include targeted commitments to reduce the issue of overweight and obesity in children and the prevalence of diabetes and obesity in adults, while also working to develop our food systems and create more health-conscious food environments. With our collective efforts, we are confident in our ability to make tangible progress toward a brighter, healthier, and more prosperous future for our country and its population. The UAE is fully committed to the recommendations of the World Health Organization in implementing a set of health measures to improve nutritional quality in the food supply chain and create healthier food environments. In this event, I'm pleased to highlight the recently finalized National Nutrition Strategy Project 2022-2030 that is aligned with the Regional Strategy for Nutrition, which was developed in cooperation with the World Health Organization. The multidisciplinary national teams working on the design of this strategy have ensured that it complements other strategies and other strategic efforts to improve food security, such as the National Strategy for Wellbeing 2031, the National Food Security Strategy 2051, and the National Plan to Combat Childhood Obesity, and also the National Recommendation for Preconception Care. All these efforts are coordinated through a clear mechanism based on the One Health approach in all policies to improve the national health indicators and reduce the rate of lifestyle-related diseases. In conclusion, I would like to express my gratitude for all the efforts made, and I'm confident that this conference will result in appropriate recommendation to improve the field of nutrition. Thank you everyone for the invitation.
Thank you very much, Dr. Noor. Now, I would like to also invite Dr. Maryam Al-Mansouri, Head of Section from the Nutrition Department.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everyone. We're very happy to have you here today. This is Maryam Al-Mansouri, Section Head from Abu Dhabi Public Health Center. As we talk and we listen from WHO and Dr. Noor, we have lots of policies, national strategies, and plans. But I'm here today just to show you what we have been doing in the Emirates of Abu Dhabi and what are we willing to achieve in the coming future. This is a brief about Abu Dhabi Public Health Center. We are a new entity. It was established in 2019, located in Abu Dhabi, Masdar City, the most sustainable city in the world. This is an overview of today's agenda. صحي program is the umbrella of different sub-grouping programs. We do have healthy menus, healthy groceries and supermarket, displaying calories in the menu, صحي in educational institution, and recently we just launched صحي at workplaces as well. This is a roadmap of our program. We started in 2013 as Wiqaya program and healthcare facilities, and then we expanded the program and we rebranded to صحي. We felt that Wiqaya program does not help us to improve the program. Consumers felt that the name is related to cancers or certain diseases, so we changed it and rebranded to صحي. صحي focus on healthy food and highlighting healthy food options in the Emirates. If we talk about صحي at healthcare facilities, what have we done actually? We include all food outlets, cafeterias, cafes, and even vending machines in all healthcare facilities, outpatient clinic as well. There is a circular that there is a mandate that all healthcare facilities must offer healthy food options at 70% and 30% of healthier options. This is just a brief of the general requirements. I just have a few minutes to present. These are our specifications for صحي food items. We have a very good impact in this programs, and this is a testimonials of certain hospitals who applied صحي programs. We noticed that patients, visitors are having healthier options now. We have our vending machine. We noticed before we start the program, most vending machines and healthcare facilities full of junk food, chips, chocolate, candies. And this is the right time to start. So we start talking with all vending machines company. We told them about their programs. We work side by side to them, having which retail item matches our criteria. And then we start talking to the hospitals and healthcare facilities as well. For sure, this is the criteria for صحي vending machine. And I think some members here already worked on this project with us. If you cannot manage it, you cannot measure it. We always say that. We had a third party working with us as a Tasneet company, an audit company. We go there and we audit all healthcare facilities and we check their compliance as well. In terms of registration, all of them registered with us. And this is the percentage of their compliance. Some fail, some success. But there is always a room of improvement and we keep having any corrective actions with them. This is as well when it comes to the vending machine. As you can see, there is an improvement of compliance as well. Displaying calories in the menu, it's a new program as well. We started it in 2021. For sure, you know, as a clinical dietitian and nutritionist here, you are totally aware about this program. We'll start talking to hotels, resorts, hospitals, school institutions, and other food outlets. Yes, it's not a mandate, it's a voluntary, but we hope that we have a bigger number of entities registered with us. صحي in Educational Institute, we just started with them this year, and we have a large contribution as well. This is a good example of a company that is covering around 80,000 students in the Emirate of Abu Dhabi, around 60 schools. They display the calories, they display all nutritional facts and صحي logo as well. This is an example how food is being displayed in school institution in Abu Dhabi. We worked as well with ADEFSA with a program called Star Rating, and this program is to rate restaurants and food outlets, and it's kind of an incentives of food outlets to join our program. Whenever they are being rated to be as A, B, and C in terms of food safety, we give them an extra credit as being a صحي food outlet by registering and following our guidelines and criteria. So every food outlet, they will have a poster and sticker in their front door or at the back of their counter saying that this is their rate and they are being صحي certified by Abu Dhabi Public Health Center. صحي in workplaces, we just started this program this year. We're still working on it, calling partners and stakeholders. And if you are willing to register with us as an entity and to be part of it, you're welcome if you are in the Emirates of Abu Dhabi. For sure, we cover cafes, vending machines, and food outlets as well. But we have different criteria with workplaces. It's in hospitals we can mandate, but in workplaces we prefer to provide healthier options and to highlight healthier options. So it's the call of the entity either to provide 100% options or other options with our guidance and technical support. So this is an option of having a 100% vending machine. This is an option of 55, 40, and let's say if they want to go with 30. The same with their menus, cafes, and conferences menu as well. We do have an awarding ceremony. It's good to appreciate their efforts, and we have our own ranking as well. This is the entities they just registered with us for the workplace program. صحي for healthy groceries and supermarket. As we highlighted in the video, we work with the Lulu hypermarket, El Grocer, and it's a very good experience. And Lulu, they come back with us, and we start with 1 outlet, and now we have 5. We're planning to expand it to 9 this year, and Spinach is now on board with us and other groceries as well. Why they were interested? Because they noticed the return values. Whenever you highlight the healthy options in the allies, we worked with them side by side, showing them what is the healthy food items in terms of retail product, how they can rearrange the whole layout and the whole shelf. As you can see, this is an example of how they applied Sahi. This is the growth rate of sales, and we're going to have a recent data as well. Just we're waiting with Lulu to analyze it. This is an example. If you can see here, we have like a pop-up coming out saying to the consumer, this is a healthy options whenever you're just moving with your car. And in your ally, there is posters, there is dangler, there is every sort of marketing to highlight the healthy option. If I can play this video. We do have, and we support food outlets and companies, and we realize that there is some cost burden when it comes to food analysis. So we do provide a free food analysis system to help them. This is how they can register in our program, how they can log in to the software. This is an example of the food analysis software, how they log in with us, how they can enter their recipes, and this is the certificate of participation. If you have any inquiry, we're very happy to answer your questions. This is our email. If you're willing to register in Sahi program, you can scan the barcode. And thank you.
Thank you very much, Dr. Mariam, and I'm sure this wonderful program can be implemented not only in Abu Dhabi, but to extend it to the whole of the Emirates and to the region GCC countries as well. Finally, I would like to thank the Saudi Society for being an integral part of this conference, and we would like to make a very exciting announcement today. There will be the MOU of collaboration between the Emirates Clinical Nutrition Society, represented by the President, Ms. Muna Al-Shammar, and the Saudi Society for Food and Nutrition, represented by Dr. Al-Dayer Al-Shammari.
السلام عليكم ورحمة الله وبركاته. I'm so happy to be here. Many important for scientists in our and also as you know I hope thank you.
I'm sorry, I will have to bring you back up on stage, Dr. Gdayer. ما علي تحرك شوي. Okay. I would like to invite our guest of honors to come on stage to plant the ghaf trees. Those will go to a reserve in Dubai to be later grown and be a symbol of the Emirates Clinical Nutrition Initiative. And we will be starting by our regional guests of honor, Dr. Gdayer al-Shimmeri and Dr. Ali al-Rashid as well. You can join us on stage, please. And Dr. Salah al-Shakeli, the head of Nutrition and Dietetics Department from Sultan Qaboos. Our guest of honors, Dr. Anouf Khamis, the Acting Director of the Health Promotion Department, Ministry of Health and Prevention. Dr. Shay Maqayed, the Director of Clinical Nutrition Department, DHA. Dr. Maryam Al-Mansouri, the Head Section of the Abu Dhabi Public Health Center. Dr. Ashraf Al-Houfi, the Consultant Head of ICU at Dubai Hospital, Professor of Medicine. Ms. Masoom Al-Jasmi, the Head of Department, Senior Clinical Dietitian at Al Jalila Hospital. Be presenting Dr. Moza Sharhan, the President of the Emirates Medical Association. Thank you for joining us today. I would also like to invite the board members to take a group photo and also planting the ghaf tree.
If I am allowed, I would like to say good afternoon, and it's my honor and pleasure to be with you. I apologize that I was not able to join you in the morning, but I was busy organizing my conference, which will be the pathology, and you're all most welcome to join us in December 16 to 17. This is the days that we are all celebrating in the UAE on the 9th of May is the Emirates Medical Day. This is not only for doctors, this is doctors, nutritionists, pharmacists, physiotherapists, nurses. We all play a role in the healthcare. We all serve a patient. So together, we are honored as an Emirates Medical Association to welcome you on board, even from the Gulf country. So, and from all the countries in the Middle East, enjoy your stay in Dubai and always come back. This is the country that loves having all the nationality. Thank you so much for inviting me today. Can anyone guess how many societies do we have in the EMA? This is one of them. Give me a number. 5, 7, 48. Say hi.
The medical nutrition therapist, head dietitian at Go Light Center in Lebanon. Ms. Joelle Farha, clinical dietitian, United Arab Emirates. As well as the board members of the Emirates Clinical Nutrition Society, Ms. Afra bin Ketta, head of section, nutrition department at Dubai Hospital. and Ms. Raisa Al-Kitbi, General Secretary of the Emirates Clinical Nutrition Society. And myself, Alia Shawab. The company who made this conference a successful company, led by our wonderful Michelin from Conveners. Thank you very much. So finally, I would like to thank you all for your attendance and patience for being with us today. For those who have managed to have squeezed in some time to attend physically, and for those attending virtually, I salute you and welcome you once again to the second edition of the Emirates Clinical Nutrition Conference. Thank you and have a nice day. Would like to invite all our guests for a group photo, please. Everyone who would like to be in the picture.
أنا بكون الأولى إذا بتمشي بهالشكل. أنا يدوب عند رجال
I think I was squeezing myself.
Oh, that's okay. Please come to the front.
I will be the speaker.